we'll get to look at reduced nephron numbers. So if the numbers of nephrons in your kidneys are reduced, how can it affect your kidney function? Okay. Reduce nephron numbers, how it affects the kidneys. So like you have this amount of nephrons. After some time, they are reduced. Does it affect you? And how does it affect you? So reduction in the number of nephrons could be congenital, where the person is just born with it, or it could be acquired, where the person has gotten it as a result of having some disease conditions. Okay. So what's the pathophysiological effect? There's hyperfiltration in the remaining nephrons. So if you're supposed to have 20 nephrons and they should handle about 300 mils of blood, if you're having about 3 nephrons, the work on them will be too much. It's just like your kidneys are understaffed. So each surviving nephrons must filter more blood to compensate. So it's it affects them. Okay. So glomerular hypertension, there's increased pressure within the glomeruli, accelerate damage, leading to scarring. There's progressive proteinuria. So there's now possibility of what the glomeruli being affected, causing a lot of cracks. So it's not being able to maintain protein in the body again, but the proteins are actually, leaking out. So the glomerular becomes leaky, proteins will spill into urine, and this will worsen the kidney damage. And there's decline in glomerular filtration rate. So the rates keep falling, leading to chronic kidney disease, and eventually it leads to the end stage renal disease. So this is just the stages. You understand? These are the stages. Okay. How function is mildly lost, moderately lost, severely lost, and the ultimate kidney failure. So systemic consequences is to cause hypertension because there's a traffic of fluid. So fluid is kept back into the body and there's a traffic of it. The cardiovascular risks is there's hypertension and proteins and also metabolic complications. There's also impaired excretion of waste products. The growth and development issues. So in children, fewer nephrons can impair growth and predispose them to having early onset hypertension. Okay. This is what we have. That's how this can affect you.